So this won't take terribly long. I could take all day, but I won't because I'm actually eager to get back here for tomorrow. This is exciting stuff. So first, I want to thank all of our panelists from both panel today again, and also just say what a terrific job Lynn did in moderating. But also want to thank you guys, the audience, for being really engaged and really dynamic throughout this day. I think we had a great day. We heard a lot about partnership, beginning with Jonathan Welch, who shared with us a really sobering story about what happens when we fail to listen to patients and families, let alone engage with them. But he also gave us some concrete ideas for the ways that we might engage in actually redesigning the system. We heard a lot about culture change and the need for culture change, and that we can't get to genuine engagement without that kind of culture change. And when we talked, I think those threads were throughout, but when we talked about shared decision making, I heard a number of key things that would help us accelerate our progress on the pathway. One being leadership, two being a workforce, right? And three also being competency. And I think we heard that in two different ways. One was competency among clinicians, and the, first of all, belief, maybe it's physician activation, right? That patients should be involved in their own decision making, that families are actually members of the care team and play an important role. We also heard about competency for patients, though, and we heard both in the sense of coaching and having the skills and the confidence and the ability to really engage in their own care. But I think we also heard a lot about, and I'm not sure this is the right phrase, but it's sort of this chicken and egg theme that I keep hearing, which is, you know, one dimension of, yes, we need activated and engaged patients, but then there's the other dimension of the brick wall they can run into in a healthcare system that is uninviting and unwelcoming in many examples to patients and families who have that desire to be involved. And we heard a lot of examples of that today. And so I think that, again, points us back to the need to change culture. I think another observation that I would make is we had some examples where once somebody got experience in doing something, whether it was shared decision making or maybe engaging patients and families in redesign, their resistance began to melt away and the culture began to change. So I think the question coming into tomorrow will be, how do we think about patients in doing just that? You know, patients as the greatest untapped resource in healthcare. I heard them described today as a new data stream. How do we harness their power, as Barbara just said to us? So with that, tomorrow we're going to tackle issues of engagement in the research enterprise and how we engage patients as partners in generating the knowledge that we need to actually improve care on a population level. We're also going to dive into how we can engage consumers in a different discussion around cost and quality. Again, we heard that previewed today. We're also going to hear from David Goldhill, who is CEO of the Game Show Network. And I don't think he's going to tell us how to do game shows as much as I would like that. I do love Plinko on The Price is Right. However, he's going to, again, kind of coming back to our theme of let's start with the patient and family members. He's going to share his experience with the healthcare system, and it will be riveting. So we're looking forward to that. Breakfast is at 7:30 tomorrow. We're going to start at 8 o'clock. We will have coffee, gallons and loads of it, and we will be done by 4:30. So please join me again in thanking all of our terrific speakers from today.